Otosclerosis. It is the disease of otic capsule characterized by deposition of new spongy and vascular bone in the region of stapes footplate. In the figure, we can see the deposition of new spongy bone in the stapes footplate. So it is inherited as autosomal dominant trait with incomplete penetration. It is more common in white races and is twice common in female than in males. In the age group, it is common in 20 to 40 years of age group, and the hormonal influence is in females. It seems to be worsened during pregnancy and menopause. Penderov syndrome. It includes the triad of otosclerosis, osteogenesis imperfecta, and blue sclera. Now, in the types of otosclerosis, it is broadly divided into histological and clinical type. Histological type is asymptomatic and there is no conductive hearing loss as well as sensory neural hearing loss. While in clinical types, it is divided into stapedial, cochlear, and mixed. Stapedial type can lead to conductive hearing loss. Cochlear type can lead to sensory neural hearing loss, and mixed type can lead to both conductive as well as sensory neural hearing loss. It is the most common type of otosclerosis. But in mixed type, the stapedial component is dominant, so usually conductive hearing loss is seen. Types of stapedial otosclerosis. The lesion starts just in front of oval window in area called fistula antifenestrum. In anterior focus, the site of predilection is fistula antifenestrum, while in posterior focus, the lesion begins behind the oval window. In circumferential, lesion begins around the margin of footplate. In biscuit type, lesion involves only footplate, sparing annular ligament, and in obliterative lesion, complete obliteration of the oval window is seen. Now, the pathology of otosclerosis. It is divided into two phases, active and mature phase. Active phase, also known as otospongiosis phase, where active resorption of bone occurs. We can see the Schwartz sign or flaming pink boss sign as seen in the figure during the otoscopy, which is due to the increase in vascularity in the otosclerotic foci on promontory. And another phase is mature phase or sclerotic phase. In this phase, there is deposition of new bone, sclerotic, less dense. Now, the symptoms of otosclerosis. The first symptom is hearing loss. It is often bilateral conductive hearing loss and the paracusis willisi, which means patient hear better in noisy than quiet surrounding. It is because normal person will raise their voice in noisy surrounding, so the patient is able to hear the loud noise. And another is tinnitus. It is especially seen in cochlear type and active lesion. Vertigo is uncommon and speech is monotonous, well modulated, soft speech. Now, in the tuning fork test, there are different types of result are seen in different types of otosclerosis. In stapedial type, the Rinne test is negative and Weber is lateralized to the deaf ear and absolute bone conduction is normal. In cochlear type, Rinne test is positive, Weber test lateralizes to the better ear and absolute bone conduction is decreased. In mixed type, Rinne test is negative, Weber test lateralizes to the better ear and absolute bone conduction is also decreased. Now Gelle and Bing test. The vibrating tuning fork is placed on the mastoid process and then pressure is increased in the external auditory canal by Siegel's speculum, and patient is asked if there is any change in the intensity of sound or not after increase in pressure. So in Gelle's test, the external auditory canal pressure is increased, and in the Bing test, the external auditory canal is blocked, and as a result, in Bing test, in the otosclerotic patient, there is no change in the intensity of sound, while in normal or sensorineural hearing loss patient, the intensity is increased. In Gille's test, similarly, the otosclerotic patient has no change in the intensity of sound, while in normal and sensorineural hearing loss patient, the intensity decreases. Now the pure tone auditometry. It shows the loss of air conduction more for lower frequencies, and there is dip in the bone conduction curve. It is different at different frequencies, but maximum at 2000 Hz. So here we can see the maximum dip in the 2000 Hz, and it is known as Carrat's knots, which is disappear after stapedectomy. So it is the characteristic feature of otosclerosis. In tympanometry, AS type of curve is seen. Here we can see in the figure at pressure 0, the normal curve, type A curve at the maximum compliance, but the compliance decreases at the same pressure in the otosclerosis, which is AS type of curve. Now the differential diagnosis of otosclerosis, they are otitis media with effusion, adhesive otitis media, tympanosclerosis, ossicular discontinuity, congenital ossicular chain fixation, malleus head fixation. Now the treatment, the otosclerosis can be treated by surgery and hearing aid facilities and medical treatment. Now surgical treatment, it is done by either stapediotomy or stapedectomy. Now the inclusion criteria for surgery: pure tone average between 30 to 60 decibel, airborne gap greater than 15 decibel, speech discrimination score greater than 60%, absence of sensorineural deafness. Contraindication for surgery: only hearing aid, Meniere's disease, otitis media, otitis externa, extreme of ages, pregnancy, and in the professions like divers, high construction workers, frequent travelers, noisy surroundings. The complications of the surgery are intraoperative and postoperative. In intraoperative, the complications include floating foot plate, submerged foot plate, dislocated incus, perforated tympanic membrane, damage to facial nerve or chordae tympani, persistent stapedial artery, perilymph flooding. In the postoperative complication, the complication includes otitis media, oval window granuloma, perilymph fistula, sensorineural hearing loss, persistent airborne gap, vestibular dysfunction, delayed facial palsy in laser surgery. Now the indication for hearing aid: extremes of ages, very active and rapidly progressing otosclerosis, cochlear type of otosclerosis, patient who refuse surgery. Now in the medical treatment, sodium fluoride is used. It is given in cochlear otosclerosis and active focus of otospongiosis, where Schwartz sign is seen. It acts by decrease in bone resorption and increase in bone formation. It also prevents enzymatic damage to cochlea. The dose is 20 mg orally thrice daily for 3 to 6 months.